First hour of Peace of Mind. I'm a Dr. Scott Grant. I'm here today. You know, we are really excited about our show that we have today. We've got a special guest, a good friend of mine, Dr. Nate Poulson. He's here with us today. We're going to talk about anesthesia. Dr. Poulson is a board certified anesthesiologist here in town with the Boise Anesthesia Physician Associates at St. Al's Medical Center. I am excited to have him here. He actually completed his residency in anesthesiology at Penn State Hershey Medical Center after finishing medical school in Tulane in New Orleans. And we are excited to have him today. He's a great resource for all of our listeners out there. And I kind of want to just throw this to you, Dr. Poulson. Let's talk a little bit about, for our listeners who are just tuning in, we always hear about anesthesia. It seems like something everybody should know about, but very few people know very much about it. So if I were to ask you, what is anesthesia? What are the different kinds? Introduce this topic. Let's go ahead for the next hour and unwrap sort of anesthesia and how it benefits our listeners.
It disassociates transmission of neurologic signals between the sensors that are out there in your body and in your brain. This can be achieved either by blocking transmission of nerves through a couple different techniques, or it can actually cause your brain to interpret or ignore signals from the rest of your body. So inducing anesthesia or causing people to be in an anesthetic state makes it so if they receive some sort of stimuli, you know, for example, somebody cutting them with a sharp knife, they don't react or notice.
Questions that a lot of people seem to ask around anesthesia is it safe? Is it safe for me? Who's it right for? And what are some risks and what are some benefits?
We can do surgery on people who previously wouldn't have survived the procedures. As far as anesthesia being safe, you know, I think most people do things on a regular basis, pretty much every day of their life, that are much more risky, even though they probably don't realize it, than having a general anesthetic. It's safer than driving in your car. It's safer than flying in an airplane. It's safer than being a pedestrian on a road. You're much more likely to sustain injury in those instances than you would having anesthesia. So thankfully, because of the technological changes,
the idea of post-surgery, you know, how long does the anesthesia stick around in somebody? You know, what can they expect for a couple of hours or days potentially afterwards? Can you kind of discuss that a little bit with us?
Sure. One of the innovations that's happened in pharmacology and the science that we use to understand drugs is that we've been able to really streamline how fast these medicines work and how fast they stop working. And it gives us a lot of control in the operating room, helping people stay in a safe zone as far as their vital signs are concerned. And it also helps them to recover very quickly. So there's been a lot of agents, especially developed and introduced into the world in the late 1990s, that allow for very quick recovery. Especially for the listeners out there that may have experienced procedures like a colonoscopy, you know, a lot of people come in for a colonoscopy and have that procedure in 2 or 3 hour span, and they'll recover and feel great, you know, maybe 10, 15 minutes after the procedure is done and go home.
Are there different types of anesthesia, like a deeper sleep than are there some that are sort of, because my understanding is that some are like, they may still be a general anesthesia, but they are a lighter sleep rather than a deeper sleep. Is that accurate?
There are different types. You know, the goals that we try to attain during any sort of anesthetic is to keep the patient safe and to keep them comfortable, and that can be accomplished by many means. One way is to just inject medicines through an IV line, or have the patient breathe in medicines that'll induce a sleep state for them, and that's called a general anesthetic, and there are certainly different considerations to go along with that. Another really common type of anesthetic that I think most people are familiar with is neuraxial. These are epidural or spinal anesthetics. Epidurals are obviously very well known and very popular because of their association with people having babies. So, you know, you don't fall asleep when you have an epidural, but you numb specific nerves in the area that you might have pain while you're having a baby. And that way the patient is comfortable and safe, and the goal is accomplished that their, the pain that they would have from having a child is reduced. Another way that can be done is nerves that supply your hand or your foot, and then you could have a foot procedure, relatively wide awake or mildly sleepy, with a nerve block, and not experience any discomfort at all, but be relatively awake for the whole thing.
I've been amazed. I know some people who had actually brain surgery who actually had to stay awake.
Yeah.
It felt no pain, and so I mean that was something to me that was like, I mean that has to be quite the feat to keep someone awake but completely eliminate any pain.
Yeah, those are interesting procedures because a lot of times they're doing those procedures to map out specific function areas of the brain so that they can only cut out portions that won't affect the patient very much. But thankfully we're helped out by the fact that the brain itself actually doesn't have any pain receptors. So once the skull is open, you can poke and do whatever you need to the brain, and the patient won't experience pain because there's no receptors for pain.
And for example, there's stuff that you can breathe in, there's stuff that you can put in the arm. Some stuff is to knock you out so you don't remember stuff, some stuff is just local for the nerve. Can you kind of unwrap the idea of the different methods and why you might choose one over another, and help us understand as the general public a little more about that?
Sure. All the nerve impulse travel through peripheral nerves up to your brain. Those kind of collect from the outside of your body and group up in the spinal cord and head up to your brain. So if you're going to block those transmissions or try to interrupt them in some way, which is really what anesthesia does, you're going to have to focus on where you want the effect to be. So, if the surgery's happening in a foot and I have good access to put a medicine around the nerve that blocks the transmission from the foot, then that'll take care of the pain for the procedure, and then I can block that nerve. But if the surgery's happening in a place where maybe blocking nerves isn't really easy to do or effective to do, then I'll give medicines that go directly to the brain that have their effect, and I can give those through either through a vein or have the person breathe in some medicines, and they both have their effect. So it's just a matter of how you get those medicines that I give people to make them fall asleep or to reduce their pain during the procedures can vastly change the way that their heart and lungs and their blood vessels function to keep their blood pressure stable. And so I have to be aware of all those changes and know how to counteract them. There's a lot of.
Let me ask you a question. Okay, people out there listening, they want to know the bare bones of this stuff. If you've been through anesthesia before and you have a procedure pending, they talk about food and that you can't eat anything. And from my experience before, when I do my surgeries, it seems like people get very upset. What do you mean I can't eat for 8 hours ahead of time? What is the purpose of that? Why does that matter? Can you help the public understand that?
Yeah, that's a really common question. I personally, I have the same experience as you. I feel really bad, especially when surgeries happen late in the day. I'm sure people are starving. And I think there's pretty poor understanding about why we do that. We don't do it to be mean, but I don't think we explain it very well. The reason that we ask people not to eat before surgery is that if any of you have ever taken a drink of water and coughed and looked to your friend and said, "Oh man, I think that went down the wrong pipe," that's something that the medical word for that is aspiration, and you have really sensitive nerves up in your breathing apparatus right around your vocal cords that sense any foreign matter on there and cause really violent coughing or other things to try to keep things from getting down into your lungs. Well, when you fall asleep for anesthesia, we take away the nerve transmissions for pain, but we haven't gotten specific enough yet with the drugs to only block those transmissions for pain. So we block the transmissions of that irritation to your vocal cords as well. And so anything that might be sitting around in your stomach, a Wendy's cheeseburger or a Diet Coke, can come back out of your stomach and get down into your lungs. You can imagine the impact that a cheeseburger would have on your lungs. It wouldn't be a positive thing.